Good afternoon, and thank you very much for coming to NATA's Lunch and Learn about Medicare and how ACA might affect your Medicare plans. I just want to welcome everybody. Thank you for taking the time out. Also want to let you know that we're creating a YouTube channel on the new NATA website, and we are going to attempt to put this film on that website so that you can view it or share it with friends so they can get the information. And I want to welcome our two guest speakers. This is Wendy Shaw, and they're both from Willamette Valley Benefits, and Tressa Gert. So I want to thank you for your time today and for helping us. And a lot of you already know Tressa because she has just been a lifesaver for many of our members and really helped you get into the right supplemental plan and goes way beyond the call of duty. So thank you for that.
Thank you.
So anyways, I'll leave it to you, Wendy.
Very much.
And I'll walk this way.
Okay. And I'm glad that you're all here to hear about Medicare and how the ACA might affect your Medicare. This is also a Medicare 101. For some of you, it might be review, and it's something that is always a good thing to understand exactly how your Medicare works. I do encourage an interactive experience, so don't hesitate to ask questions if you have a question about what we're talking about. That is our little crew. So Willamette Valley Benefits, which Tressa works at, and like Kathy said, most of you do work with Tressa. We have an office in Clackamas, off of 224. We started off in 2007 as a tiny little company, and then we've grown. So, and we don't discriminate. We would like a guy, but so far all it's been is guys, and so far wanting to work with us for some reason. Anybody hear about the Affordable Health Care Act? Obamacare? Anybody?
Oh, yeah.
Yes.
Okay, all right.
We all know about that.
It's been in the news a little bit. It's affected our business a lot. We primarily do work with Medicare. 90% of our business is Medicare, but 10% of our business is for people that are individuals and don't have insurance. So you might have somebody in your family that doesn't work for a company that offers insurance, and so they have to buy it on their own. Or you might know somebody that just hasn't been able to afford insurance. The Affordable Health Care Act is a lot of things. The reality of what's happening is, I think, surprising a lot of people. As far as how it relates to Medicare, it doesn't relate very much. The most prominent thing that is affecting Medicare is the enrollment period for people that are trying to sign up on a plan through the Affordable Health Care Act is right now. People that are on Medicare that want to make a Medicare change, their time for them to do that is between October 15th and December 7th, right now. So there's a limited number of people who are experts in this, and so it's been a challenge for people to try to get the help that they need to make the decisions that they need to make. So a lot of it is just the volume of people trying to get through the system all at the same time. The Affordable Health Care Act officially was supposed to open in Oregon under a program called Cover Oregon on October 1st. This is November 1st. Still nothing has happened, but we're hopeful that it will happen soon. In January, the policy, I know, it's January, people's coverage should begin. And again, this is not for Medicare. This is for people that are not on Medicare or not on group insurance. There will be tax credits to help people pay for their premium on these individual plans. There are no tax credits for people on Medicare. I get calls every day from people wanting to know, how can I get that tax credit to help me pay my Medicare premium? You can't. There is no tax credit for Medicare. For people that qualify for these individual plans, though, there can be a considerable help. The problem is right now, the only way they can get that help is to go through the website called Cover Oregon. So that has been in the news a lot lately because of the delay.
Does it work?
Does what work?
The website?
No.
No.
They're
Not yet.
hoping, the latest projections are a month or two.
Oh, good.
The issue is that people have to enroll by December 15th
Yeah.
to have a January 1 effective date. Their plan B right now is paper enrollments.
Oh.
So that's what we're working with now, is paper. So this slide indicates again that you do not, Medicare beneficiaries do not need to enroll through the exchange or Cover Oregon for their Medicare. You can do just like you're doing now. You can work directly with the company. You can work with an agent like Tressa, and you do not need to get onto the exchange. Every day we get calls from people thinking, I need to do something because they're Medicare and they don't. And the main thing, the third point on this slide is that it's at the same time. The open enrollment window for the Affordable Health Care Act this year was October 1st through the end of March. In 2014, the open enrollment window for people on the Affordable Health Care Act plans will be October 15th through December 7th. Same time as Medicare.
Should we hand out those handouts you have?
Do I have handouts?
Yeah.
Oh, sure.
That way they can kind of
Press
put
that
notes
one.
on
No,
those.
we hand out handouts.
Perfect, thank you. I
This is the
forgot about
PowerPoint
that.
presentation.
I did too.
We also, so any other questions on the Affordable Health Care Act or Obamacare before we move on to Medicare? Nothing, okay.
Across the camera.
I know, probably lots of questions, right? Probably lots of comments, but we won't go there. We'll be here all day. Well, a lot of people do call us when they are going on to Medicare and they have employer coverage and they want to know what they should do. It is a complicated question. It's not a complicated question, it's an easy question. The answers can be complicated. So what we would like to recommend to people is if you're turning 65 and you're on an employer plan, it never hurts to call and talk to somebody that knows what they're talking about to find out what your options are. If you work for an employer that has less than 20 employees, then you might want to make sure you get Part B, Medicare. If you work for an employer that has more than 20 employees and you're still actively employed, there's really no need to do that. These rules can change though year to year, and so again, we really recommend you talk with somebody, either at Social Security or a qualified agent, to make sure that you're getting the new straight answers. Does anybody here have a card that looks like this? Red, white, blue Medicare card? A couple people. Okay, congratulations. It's a good card to have. Medicare Part A and B you get from the Social Security office. They are the administrator for both your Social Security pension and for getting that Medicare card. There's 4 parts to Medicare: A, B, C, and D. A and B you get from the Social Security office. C and D you have to buy from a private company. Does anybody know what Part A would cost if you had to buy it all just out of your own pocket, which some people have to do?
Like every month?
Every month.
$500.
Close, $451. Very good. Yes, I wish I had a candy bar I could throw you.
I just lost the
Never
two
mind.
and milked it.
If you have worked 10 years in the United States, or been married to somebody that's worked 10 years in the United States, and you paid into the system for 10 years, you don't have to pay the $451. But some people do have to pay that because that's the actual value of that premium. Part B, premium, you do pay something for that, either out of your Social Security check, or if you're not yet collecting Social Security, you get a bill from Uncle Sam every month. Does anybody know what that Part B premium is?
I just read it.
96.
Why is 96? It went up a little bit. It's $104.90. $104.90 this year. And next year, it'll stay $104.90. So I have good news for everybody. It's not going up. The $104.90 represents 25% of the actual cost. So your Part B is worth over $400. So in essence, going back a little bit to the Affordable Health Care Act and tax credits and subsidies, Medicare is heavily subsidized. So the other thing I tell my folks on Medicare when they call and they say, I want a tax credit to help me pay my Part B premium. It's already subsidized, so there is no more money. That Part B, that A and B card costs most people $104.90 a month. And with that, essentially, you have 80% coverage. There's a little bit more detail that we'll get into, but that's the big picture.
And that's a good thing.
What's that?
That's a good thing.
It is a good thing. It's a very good thing. Part C and Part D are your Medicare Advantage and your prescription drug coverage. Does anybody here know what a Medicare Advantage plan is? Anybody have one?
Pays the other 20%.
Well, that's a Medicare supplement. So there's 2 different kinds. That's what we're going to talk about next. We've mentioned this. Your cost for Medicare, Part A is free for most people. Part B is $104.90. Part C, your Medicare Advantage plans, premiums can range from $0 up to $199 a month. Part D, drug coverage can range from $12.60 a month next year up to over $100 a month. So it just depends on the plan that you pick. This is a very hard slide to read. But this slide here, which is probably very hard to read on your handouts too, is a slide that indicates, and I'll tell you what it says, is that if you make more than $85,000 a year, or if you and your spouse make more than $170,000 a year, you pay more than the Part B, more than $104.90 for your Part B premium. So it can be substantial. That is a part of the Affordable Health Care Act, which again, this does affect Medicare. It's another little way that does affect Medicare, is that people that have higher incomes, and if it's over $214,000 for an individual, your Part B premium would be $335, not $104.90. So there's also a Part D surcharge, or a tax, that would be $66.60 in addition to whatever premium you're paying just for your prescription drug coverage if your income was over that threshold. So these surcharges are going towards helping to pay for the new Affordable Health Care Act. Any questions on that? No? It's good news, bad news. If you're making a lot of money, you get to pay more. If you're not making that much money, you don't have to pay. So if all you have is that red, white, and blue Medicare card, again, it's not bad coverage. What you get is you have a hospital deductible for next year is going to be $1,216 if you end up in the hospital. And then there's a $147 Part B deductible, and you would also pay 20% for all of your surgeons, the anesthetic, ER, ambulance, chemotherapy, surgery, office visits, lab, MRIs, all of those types of services you pay 20%. There's no cap to the 20%. It goes on forever. So, yeah. So most people want to do something else. There's no coverage if all you have is Medicare while you're traveling outside the United States. So that's something to keep in mind. This little house, if you've been to one of our presentations before, is a critical piece of our education. And we designed it to help people understand what your options are when you go on to Medicare. And this is where we're going to talk about the difference between Medicare Supplement and Medicare Advantage. Question?
What was the going out of the country? I missed.
Going out of the country, if all you have is Medicare, the red, white, and blue card,
Yeah.
there's no coverage outside of the United States.
Oh, I see. So Medicare does not cover outside the A and B do not cover outside the United
The
States.
A and B do not cover outside the
Okay.
United States. Good question. Any other questions? So this foundation that we have here, your Medicare A and B, you have to have that foundation in order to have any other coverage. Whether you want a Medicare Advantage plan or whether you want a Medicare Supplement, no matter what plan you pick, you must have Medicare A and B. And we represent it as a foundation to help people remember that. That $104.90 is a very integral part of your insurance. If you want to do something else, you really have two choices. You don't get to choose both. You can't have both at the same time. You can do one or the other. You could choose to go onto a Medicare Advantage plan. And how the Medicare Advantage plans work is you end up having Medicare take over the administration of whichever company you choose. And there's several companies that offer Medicare Advantage plans. And they are in your mailbox probably every day advertising, please sign up for us. How they work is, remember the value I said your Medicare card was probably close to $800 or $900 a month between Part A and Part B and all the subsidies? Those companies get that money from the federal government, and then they become your Medicare administrator. These plans have been around since Nixon. They've been around a long, long time, and they worked very well. As long as your doctors line up, and as long as you like the hospitals and the providers that are in those programs, they can work very well because they have everything under one roof. You have your Medicare A and B, you have your prescription drug coverage, is all wrapped up together into something called Part C. That's what a Medicare Advantage is your Part C coverage. These are the plans that can have a zero premium all the way up to $199. So they can do zero how? They can do zero because
Subsidy on A and B.
they get money every month from the federal government, about $800 or $900. So if you know the cost of real insurance, and you've seen your premiums, you know that's not an unusual premium for an insurance policy. A Medicare Advantage plan might have a premium of $61 a month. There's no way they can run it on $61 a month. So they have to have those subsidies in order to make it work. Whether you never go or whether you have a $2 million bill, whichever company you pick becomes your Medicare administrator and they pay the bills. With Medicare Advantage plans, you have co-payments. You might pay $10 or $20 or $40 to see a doctor. You might pay $200 a day to stay in the hospital for a while. All of them have a stop loss or something called an out-of-pocket maximum. Is that a term that you're familiar with?
Mm-hmm.
What an out-of-pocket maximum is like a safety net. It protects you in case you have a really bad health year. We had a really bad health year in August. It was my husband had a bad health year. So three ER visits, an ambulance ride, and a 3-day hospital stay. My out-of-pocket maximum is $13,000. And then I have 100% coverage. And we paid out $13,000 this year, which meant we had a lot of medical bills. I was thankful to stop paying at $13,000. Most of these Medicare Advantage plans have out-of-pocket maximums between $2,500 and what's the highest, Tressa? Maybe 8,000, 8,400. 8,400 is the most you would pay. So they're reasonable. And that's why you would want to do something besides Medicare, is to have a stop loss on what your out-of-pocket costs are. Every year between October 15th and December 7th is when you can make a change. And it would take effect January 1. Any questions on Medicare Advantage? Yes.
So you sign up for the Medicare Advantage and you keep it for 1 year, and for who knows what reason you don't think you like it, then that next year between that time, you could go to a supplemental one, a regular one, rather than the Advantage.
Oh, I like your question. The question is if you sign up on a Medicare Advantage plan, and for whatever reason you decide you don't like it, during the annual election window, can you then go over to a Medigap policy, a Medicare supplement? The answer is maybe.
Oh, good.
I know. So let me explain how the Medigap policies work or Medicare supplement policies work, which you see the one-way arrow that goes from Medigap to Medicare Advantage, and there's not an arrow that goes the other way. Okay, so that's going to answer your question in just a minute. It's a very good question. When you're brand new to Medicare, just got your card, spanking new, Part B, and you can get anything you want. You can get a Medigap policy, you can get a Medicare Advantage plan, everything's guaranteed issue, they can't turn you down. It's, it's like the kid in the field, skipping through the field. You can have whatever you want. Medigap policies, they're guaranteed issue as long as you get it within the first 6 months of you being on Medicare Part B. After that, they can ask you health questions. Now, there's a very few other exceptions that you're allowed to go to a Medicare Part B, and go to a Medigap policy, and I will explain what those exceptions are. When you're brand new to Medicare, it's really important that you know what your options are, and you make an educated decision which way you're going to go in the house. Are you going to go with the Medicare Advantage plan, or do you want to start off with a Medigap policy? Because if you start off with a Medicare Advantage plan and 2 years later, I don't like this, I want to go to the other kind, you might be able to get it if you're in pretty good health, because they can ask you health questions and they can turn you down or they can accept you. Okay?
It would just be based on your health?
It's based on your health.
Okay.
Okay. So when you're brand new to Medicare, the other way you can go, you can have Medicare A and B, they pay about 80% of the bill. The Medigap policies pay 20% of the bill, depending on the plan that you pick. There are standardized plans, letters A through N. The plan I'm talking about is letter F, as in Frank. We like F because for everything that Medicare covers, it picks up the balance. It also covers things outside the United States for emergencies. So that's why we like F. It runs around $111 to $180 a month, depending on the company you pick and how old you are when you go on to Part B. If those prices are different when you call us, it's because things have changed, okay? So they're not set in stone, but for today, that's about the average. If you go onto a Medigap policy, there's some pros to that. There are, you have 100% coverage. You have 100% coverage for your medical cost. Medicare pays 80%, the GAP plan pays 20%, you have no co-pays for your medical services. Sounds pretty nice. Before you pick that plan, make sure your doctor will take it.
Oh, yeah.
A lot of doctors won't work with that style of plan because they don't get paid 100%. They have to write off about 70% of their bill. So you think about what you guys do. Think about maybe 50% of your customers coming in and you're only getting paid 70% of what you normally would get.
They won't come in long,
Yeah.
because you won't be there.
You won't,
Yeah,
yeah.
exactly.
And that, you won't, this gentleman said they wouldn't be coming in at all because you guys wouldn't be there. Doctors are in a real hard spot trying to balance their practices. It's a very hard thing for doctors to make that decision, and some are doing it, well, they won't see patients on that. There are a lot of doctors in this area that still do. And if you're already established, you've got a really good chance that you won't have a problem. But we're seeing a trend of more and more doctors not taking patients on this style. So it's just something to be aware of. Now you see the arrow going the other way. So what happens if you start off with the Medigap policy and all of a sudden your favorite doctor in the world says, I can't afford you anymore, sorry. What happens is most of those doctors tell you they will still see you if you go onto a Medicare Advantage plan. And then you can change between October 15th and December 7th to go onto one of the plans they will accept for a January 1. The reason doctors like Medicare Advantage plan better is they get paid a higher percentage. So they do get a higher reimbursement from those companies than they do on Medicare. So there's pros and cons. The other pro on the Medigap policy that a lot of people like, there's no referrals, there's no prior authorizations. If the doctor says go get an MRI, you go get an MRI.
And that's what the Medigap.
That's on the Medigap. The Medicare Advantage plans are managed care programs. And there's nothing wrong with that as long as you have a good doctor and are comfortable with the idea. If the doctor says go get an MRI, you know it's going to be reviewed. And if it's the right service, at the right time, at the right place, you're going to get it done. There's very few declines or denials on prior authorizations. So I know it's a concern for people, but it's rare that we ever have any complaints on that. The advantages of a Medicare Advantage plan, besides paying doctors better, you get all the little goodies sometimes. You can get a gym membership possibly, you can get routine vision care, there might be benefits for eyeglasses, so there's extra little benefits for people to go on to Medicare Advantage plans.
Dental? Is there any dental?
Sometimes there is dental, but not all companies offer the same little perks, and they can change every single year.
So what if you're on the you have the Medigap plan, and your doctor, the only doctor you could find that would see you on that plan, sends you for an MRI, or says you need an MRI. Now, are there certain hospitals and facilities that won't give you one because you have Medigap insurance? Or?
So the good question, all these questions are good. Another good question is, if you're on a Medigap plan, which is in the green box over there, and you don't need a referral, and your doctor says go get a referral, are there different doctors or hospitals that do those things that won't see you? At this point, you should have no problem getting in. Specialist hospitals are still taking Medicare without any issues. It's the primary care doctors that we have a hard time finding. We have a really hard time finding for our new Medicare people if they don't already have a doctor. So there's pros and cons. It's not right or wrong. Every day people ask Tressa and I, well, what's the best plan? It depends. It depends on your budget, it depends on your doctors, it depends on your drugs, it depends on your travel. There are many, many choices. And you could throw a dart and maybe pick the right plan. You could do some research and narrow it down. what we do, and we don't, our services are free. How we get paid is we get a commission from whichever company that we put you with, but your premium stays the same, whether you work with an agent or go direct with the company. And what we do, and you can tell we're pretty passionate about it, we want to make sure that your doctors line up, that your drugs line up, and that it's affordable. So, got into this business 32 years ago because it was really simple.
How's that working for you?
Simple would not be the answer.
Yes, another question.
So what does Kaiser do, and what is Kaiser Senior Advantage?
The question is, what does Kaiser do and what is Kaiser Senior Advantage? One of the interesting things about what I do is I'm not allowed to answer that question because we did not file with the federal government to talk about different companies and different benefits. So in order for me to talk about company names, which I haven't said any names, or company benefits, I have to file with the federal government to do that.
But you can't tell me whether that's Medicare Advantage or whether that's Medigap?
That is one of the Medicare Advantage policies.
Okay, that's all I need.
Okay.
Thank you.
I think I skirted the line okay on that.
Okay.
You see on Medigap, we see on Medigap that there's also prescription drug coverage that you can and possibly should purchase. Medicare does not cover prescription drug coverage prescription drugs you pick up at the pharmacy. So the Medigap plan will not pick up prescription drugs that you pick up at the pharmacy. If you want to get prescription drugs and you're on that side of the house, you need to pick up a separate drug policy, a standalone prescription drug policy.
On which side, I'm sorry?
On the right
Yeah.
side of the house. So if you're on Medigap, you also need to add a prescription drug plan.
See how the house is built?
Yeah,
So the
It's on your left side.
gotcha.
Yeah.
So what happened with prescription drugs? There was no drug coverage before 2006 on Medicare. No drug coverage. So in 2006, we passed a law, that was Bush, passed a law, now we have drug coverage. We'll be getting into more detail on that. But the thing I want you to understand here is if you want drug coverage, you must get it when you're brand new to Medicare. If you don't get it when you're brand new to Medicare, because A, you take no drugs, B, you don't think you need it, and later you want to get drug coverage, then you will be penalized.
Oh, yeah.
Okay, and the penalty is 1% a month for every month you delayed getting drug coverage. The penalty lasts you for the rest of your life. Forever. The penalty is based on the average Part D prescription drug premium, which this year is about $32. So 1% a month for just say 10 months, say you delayed, so I can do easy math here, that would be $3.20 a month. Every month would be added to your premium for the rest of your life. Not a big deal. I have some people that have waited 72 months. So it ends up being to be a little bit more money. That's still not a big deal, usually, because the penalty in my mind is what happens is if all of a sudden you call me up in March, which I had a client do, because he didn't want to take drug coverage, and he called me in March and said, "Hey, Wendy, can you sign me up on that drug plan now?" I said, "I can put you on a list and I can call you in fall, because you can only enroll on a Part D drug plan if you don't pick it originally between October 15th and December 7th, and it will take effect January 1. And he said, "Well, you don't understand. I need it now." I said, "I understand. I can't do it now. What's going on?" And he was taking a drug that was $300 a month.
Oh.
So in my mind, his penalty was he had to pay $300 a month for his drug until January when it went down to $45 copay. So we encourage you to get a drug plan whether you take no drugs or very few drugs, just in case. But it's a choice, you don't have to.
You're always talking about the enrollment between,
October 15th and December 7th is the enrollment window.
but my card isn't good till February because I'm not 65 till February.
That's a good question. So what happens if you turn 65 sometime besides October 15th through December 7th?
That was
You're
the
not out
question.
of luck, you're okay.
Oh.
It's good, yeah.
Oh, good.
You have what's called an initial enrollment window when you're brand new to Medicare. It's the 3 months before your birthday month, and 3 months after. So it's a 7-month window that you can enroll. We obviously would encourage you to get it done for the first of your birthday month. Your Medicare effective date will be the first of your birthday month unless your birthday falls on the 1st. And then it's effective the first of the prior month. So that's just a little trivia for the test at the end.
Test.
Okay, CMS, Center for Medicare and Medicaid Services, they're the ones that set all the rules about what I can and can't say. And they're the ones that oversee all of this.
Who is a CMS?
Centers for Medicare and Medicaid Services, the federal run program.
They're the ones who run the federal exchange
They are the ones.
website that.
As well as Medicare.
As well as Medicare, right.
As well as Medicare. We haven't heard from them too much this year. Yeah, they've been a little busy.
A little busy.
Tied up.
Yeah, they've been a little busy. One more slide on Medicare supplement, the Medigap type of policy. There was a new rule in the state of Oregon. Washington does not have this rule. Oregon does have this rule that says that if you're on a Medigap policy, which is the kind that pays after Medicare, and you decide that you don't like the premium that you're paying, during your birthday month, so it's called the birthday rule, you can make a change to a like plan, it's Plan F to Plan F if you want, and it's guarantee issue. They can't turn you down. So it's a lot of people are saving quite a bit of money, and if you're in that position, call Tressa, and she can help you, and she can help you move during your birthday month for this type of coverage, the Medigap policy. It's a different window than the other windows that we've been
Could they
talking
make
about.
it
It's
more
your
confusing?
birthday month. I know. Don't hesitate to call. And then
Right.
one last thing on this Medicare Advantage, in order to qualify for that, there's just 3 things that they need. They need to know if you live in the service area, and all plans have different service areas that they have, and that's basically certain counties that you must live in order to have the policy. You have to have Medicare A and B, and there's one health question they ask, and is that if you are on kidney dialysis. They want to know if you have end-stage renal disease. Other than that, it's a guarantee issue, they have to accept you. So it's easy to get a Medicare Advantage plan. There are 3 types of Medicare Advantage plans. I know. This is back to the house slide was the longest, the rest of this is going to go quick. HMOs, health maintenance organizations. PPOs are preferred provider organizations. An HMO with a POS is a hybrid. It's a health maintenance organization with a point of service opt-out. I call it an HMO with a back door. There's just one company in Oregon that offers that, but it's a good option to have. A PPO means you don't need a referral to see a specialist. That's what a PPO basically means. You can see any doctor that will see you in the country. It's a Medicare doctor. You just pay a higher copay if you go out of the network. HMO means that you have to get a referral to see another specialist. Prescription drug coverage. So remember I said before 2006 there was no drug coverage. It was heartbreaking. We had people on insulins and MS drugs, and they're hundreds and hundreds and thousands of dollars, and they had to pay out of their pocket 100%. Now we have drug coverage. Congress designed this plan. Okay?
Uh-oh.
And it's better than what we had before, which was nothing. There's 4 phases. No matter which prescription drug plan you go with, whether it be a standalone drug plan or a Medicare Advantage plan that includes drugs, has the same 4 phases. A plan can have a deductible. In 2014, that's between $0 and $310, so they may or may not have a deductible, but they could. There's an initial coverage limit. In 2014, that's $2,850. And I'll explain what these are in just a minute. There is a donut hole. Anybody heard about the donut hole?
Oh, yeah.
Yeah, not the good kind.
Right.
It's a gap in coverage of $45.50, and if you make it through all of that before the end of the year, then you are in catastrophic and you just pay 5%. So a quick example. Let's pretend you are on a plan and you have a $100 drug, and your copay is $5. You pay $5. The drug is $100. What does the insurance company pay? $95. So $100 is subtracted from that $28.50 because it's the cost of the drug, not what you pay, that counts against the initial coverage limit. 80% of people never go through that because their drug costs are less than $300 a month. If you go through that, that's when you land in the donut hole. And I have a whole other slide to talk about the donut hole because it's gotten even more complicated. What happened initially is you had to pay 100% during the donut hole. That's why it was called a gap. You had to pay 100%. But one of the things the Affordable Health Care Act did is that they're shrinking the donut hole. That's a good thing for Medicare. Okay, so we're going to go on to the next. This is a slide we created to try to help people understand the donut hole. By 2020, you will be paying 25% for your drugs. 25%? 25% for your prescriptions during the donut hole by 2020. So just hang in there. By then, it'll be really small. Until then, every year, it's going to get about 2.5% better to you. So it'll be reduced about 2.5%. So during the donut hole, if you go through $2,850 worth of drugs, what counts towards the donut hole is if you had a deductible, what you paid towards the deductible, any co-pays or co-insurance that you paid for your drugs when you're in the initial coverage limit. So by the time you get to the donut hole, you might have already paid out $1,000 out of your pocket between deductible, co-pays, and co-insurance. So that would mean there's $3,550 left to pay. When this bill first started, you had to pay $3,550, but now there's help. Now, for your brand name drugs, you pay 47.5% for that brand name drug. So if it's a $100 drug, you pay $47.50. The insurance company pays $2.50, and the manufacturer has to write off $50.
50%.
50%.
Well, we're talking about.
What counts towards the donut hole this year is $97.50. What you pay and what the discounted rate is, not what the insurance company pays. So your $35.50 would be $97.50 less. So every time you get a brand name, you will have money count against that, so that eventually you might have paid and the pharmacy manufacturer may have discounted to the point where you have fulfilled that donut hole and there's nothing left. At that point, you pay 5%. Very few people end up there. One of the really cool things we can do in this government website that works really great, and you can go on it yourself if you want, is www.medicare.gov. And we do this for our clients every year. I know Tressa's probably done it for all of you guys. She types in your drugs onto this website, and it tells us exactly what you will pay and where you will end up by the end of the year based on that list of drugs. So it's a big piece of the puzzle for some people. Other people, it doesn't matter at all because they take very few drugs. But for some people, it's critical. If you shop your drug plan every year, the average saving is $600.
Oh.
So when I say it's not good to throw a dart with this stuff, it's huge differences. Every company negotiates independently with every single pharmacy manufacturer every single year for every single drug. Your drugs, if they're covered this year, does not mean they're covered next year on the exact same plan. So it's a very important thing. And where we get kind of excited about it is we don't want to get calls in January from our clients saying, hey, my drug's not covered anymore. What's going on? Well, send us your list in October and we can run it and we can tell you if you should stay on the plan that you're on or if maybe you should look at doing something different. So that's one of the services that we offer. Questions on the donut hole? Drug coverage.
That's Medigap or the,
That
both.
is
Both parts
Medicare
of the
drug
house.
coverage
That's gonna just be on the gap,
can be
right?
included in a Medicare Advantage plan, or if you're on a Medigap policy, you would be buying a standalone drug plan. So all of those figures that we were talking about are true in both kinds of
Both,
plans.
okay.
Oh, they are.
Both kinds of
so you get the
plans.
donut hole in both
Either
sides
No
of the
matter
house.
what drug plan you go
Oh,
on,
okay.
it's going to have those same numbers.
Okay.
Okay, and that is the one foundational line that we have for everything else to be based off of.
What about generic drugs?
Generic drugs can be very inexpensive, and they can be expensive, it just depends. Yeah. So I've seen some generic drugs be $200 a month, and I've seen generic drugs be $2 a month. So it just depends.
Or zero.
Or what was that?
Or zero.
Or zero. Some plans now have a new tier, and they're encouraging you to use the drugs in this special tier, and you could get your drugs for no cost. So, not all plans. Some plans. Okay. Okay, yeah, you need to go there. What this slide is, it talks a lot about what I just discussed. I'm not going to go over all of it. The point on this slide I want to make sure that you understand, and the insurance companies and the federal government are requiring me to tell you this now, is that your plan may require prior authorization for certain drugs, it may require step therapy, and there may be quantity limits. Again, this can vary from plan to plan and from drug to drug. And it's not unique to Medicare. You may have this on your current group insurance. And all it is it's wanting to make sure that things are as cost efficient as possible. There are some, and what I call that when we're researching that part for you is the hassle factor. Some people are willing to pay a little more money not to have to jump through those hoops. And sometimes we can help you find a plan that would be that way. Other people would just want to pay the least amount of money, and they say, give me as many hoops as possible, I don't care. I just want to pay the least amount of money. So it's something to be aware of. And again, the Medicare.gov website tells us, it can tell you which plans have the restrictions on each of your drugs. The other big important thing, the last bullet on this slide, and we're seeing more and more evidence of this, is the insurance companies are negotiating with different pharmacies to be preferred and non-preferred. Or you might see preferred network and network. You would think network would mean, well, that must be good, right? Well, preferred network is better. So there have some different lingo. Each plan is calling it something a little different, but the thing to be aware of is that you can get a better price on your drugs if you go to whichever preferred system they have for the pharmacies. These are the Medicare changes. We discussed the donut hole is shrinking. We talked about the increased premiums if your income is higher already. If you change plans, the insurance companies are now required to call you within 15 days. Make sure you understand how your program works. We actually get in trouble if we don't tell you that. We get a call from the carrier. You didn't call them.
How do you know that?
Yes, we do. We get a call from the carrier that says, you did not tell John Smith that we were going to call him. So we tell everybody, you're going to get a call. Anybody been called about the wellness exam? Oh, really?
I got email about it.
Oh, from your plan?
Yeah.
Yes, okay. Anybody hear about the star rating system, where all the Medicare plans have different quality levels? You've heard about it. Okay, so Medicare ranks health plans from 1 to 5 stars. There was one plan that was a 5-star plan until this coming year. Now there will be 2 plans in this area that are 5 stars. Having a higher star rating means that the companies did a lot of work with the federal government in a lot of different areas. There's quality indicators that they have to meet. They have to do a certain number of wellness exams, which is an exam where they want to make sure that you're taking care of yourself and then see if there's any kind of health issues that are not being taken care of. And then there's complaints. They look at the complaints. There's many factors that go into those star ratings. If a plan is given a 5-star rating, they can sell all year round. Which explains why your mailbox might be filled this year with information from 2 companies, because they can sell to you outside of that annual election window of October 15th to December 7th.
Do you go to Medicare.gov to find the star rating for your plan?
You can go on Medicare.gov to find the star ratings for your plans. Absolutely. And also in all of their material, they are required to put the star ratings.
Oh.
Yes.
But the star ratings aren't actually ratings from people that have used the plan and are happy with the plan. And
The star ratings are partially, there's a partial component of people that have used the
Oh, okay.
plan and their happiness with it.
Okay.
A lot of it, though, is how well the carriers have done in getting the claims data information to the government to analyze it and make sure that flu shots are being given, wellness exams are being done. These carriers are required to perform to a certain level of preventative and wellness.
Okay. think
We can go to you to find the star rating?
You can come to us to find the star
that's the
ratings.
best place
There
to
you
go,
go.
right over
Yes.
there. Trust them.
The annual election window, that explains why Tressa and I are moving at about half speed right now, or double speed, depending on what's going on. It's a busy time of year. We really do encourage people, though, to review their plans. If you're happy with your plan, you don't have to do anything. But be aware, it may not be identical. 2013 will not be identical to 2014. There's always changes. But if you're happy with the changes, you don't have to do a thing. If you know of somebody that might qualify because they have a lower income, there's a program called Low Income Subsidy, which is extra help from the federal government to help them on their prescriptions. They have no donut hole. So there's a lot of people that are unaware of this. Tressa and I help a lot of people, and our whole company has, in getting people enrolled in this program. You go through the Social Security website to do it, ssa.gov. With low income subsidy, so that's an important thing. If you qualify for low income subsidy, that's a special election window, and you can make a change to another company, to another Medicare Advantage plan, if you qualify for low income subsidy. If you move to a different county, yes.
Is there a income floor below which that takes place?
Let me see if I put that here. It is not here. So do you know what the income is for that, Tressa?
I want to say for single, it's about 17,000 per year, and then for couples, 24,000 or
Yeah,
so.
we can get the exact numbers on this, but we believe for an individual it's around 17 a year, 17,000, and for a couple around 24,000 a year in
And
income.
the subsidies vary?
The subsidies can vary. The best subsidy means that they only pay a little over $2 for generics drugs and a little over $6 for brand name drugs, and they have no donut hole. And they get help with their premium. So it can really make a difference for some people. Okay. There's also asset qualifiers, and they do change year to year. And if we need to, we can add a slide to this to have people look at that. Special election windows, again, this is if life happens, you lose employer coverage. If you end up moving to a different county with different options, you can make a change. If a plan terminates, which we've had a couple plans actually decide they're not going to do this anymore for that particular plan, you get a special election. And that's one of the opportunities if your Medicare Advantage plan leaves you, or if you leave your Medicare Advantage plan by moving away from it, you can then go on to a Medigap policy, guarantee issue. Okay? If you have questions, please feel free to call 503-659-5566. We are working lots and lots of hours. We're there year-round. We don't just work during this time of the year, and we're happy to help you guys with any questions.
That phone number's not on this card.
Is that Tressa's number?
The 800 number's on there.
Oh.
The 800 number. Here, let me look at it real quick.
No.
No, I want to put Tressa's number on there.
I
And you
was
can call
gonna-
Tressa Berg at 503-810-2925.
25.
Want me to hold that?
Yeah, let's hold it over.
2,500.
That's it, 503-810-2500. And toll free, 1-800-944-4644.
And she has some cards over there too.
And we have cards over there too. Yes. Other questions?
What's the connection between Medicare and Medicaid?
That's a very good question. What's the connection between Medicare and Medicaid? Medicare is a federal program. Medicaid is a partnership between feds and state.
Right.
Okay. You qualify for Medicaid because of low income
Mhm.
and or disability.
So you can get, even if you're on Medicare in some cases.
Some people have Medicare and Medicaid.
Right.
They're called dual eligible.
That was the word I was thinking
Yeah,
of.
they're called dual eligible. And that is a possibility. You need to contact the state of Oregon to see if you qualify for Medicaid. Okay, other questions? No, you guys have been great. Thank you very much.
Thank
It's been
you,
a pleasure
Wendy.
as always.
Yeah.